Hi, Madina. Welcome to the A Word to the Wise podcast. It's so great to have you. How are you doing today?
I'm good. I'm super excited to be here.
Yeah, it's great to have you. So the first things first, I really want to get into what got you interested in your line of work as a counselor and now a director of operations for NOCD.
Yeah, so I guess how do I make a long story short? So I got into mental health in general because I really like understanding why people become the way they are. But in particular, I got into OCD unknowingly. So I was actually recruited by NoCD, which our company mainly treats OCD. Years before I got recruited, I was reading a lot about kind of like Buddhist philosophy. I'm not necessarily religious, but I'm really into yoga. And I love reading books about kind of just the concepts of yoga philosophy. And a big part of yoga philosophy is learning to lean into discomfort and to accept uncertainty. And so I read a lot of those books. And then years later, I was actually recruited, like I said, to NoCD. And the whole crux of the type of therapy we do is to teach people how to learn to live with uncertainty and discomfort versus trying to get rid of it. And so as soon as I started practicing, I realized how passionate I was about it because I was already practicing it essentially. And so being able to teach other people that has been so rewarding, and to see it actually change people's lives. Um, so that's kind of like the therapy piece. And then I do help a lot, or I do a lot of like operational stuff for the company too, which is really cool because I'm helping manage the providers and helping them learn these skills so then they can teach their clients what are the best ways to handle their OCD.
Yeah, no, it's awesome. I remember going on your page and I just thought, you have a lot of content, like you said, on like Buddhist philosophy or just accepting that life is hard and not
Yeah.
really running away from that discomfort. And I'm going to get into all of that a little bit later, but that was one of the reasons why I was super excited to talk to you because I think a lot of reasons why a lot of us tend to have anxiety and or potentially OCD is just dealing with the uncertainty of life and how like the rug can be pulled from underneath you at any moment and like that freaks people out. So I really just love that that is something that you combine with your counseling and therapy in general. So I want to talk about the different anxiety and or OCD disorders that you encounter often.
Yeah. So mainly right now I am treating OCD, although I do have like a small private practice where I'll treat more like generalized anxiety disorders.
Mm-hmm.
But yeah, so I guess the simplest way I can describe it is OCD is essentially the presence of obsessions and compulsions. So obsessions are known as unwanted or what we call intrusive. They can be thoughts, images, urges, they can even be sensations. And because the person is so distressed by that intrusive thing, they then feel compelled to engage in what we call compulsion. So that's mental or physical behavior that is done to either reduce the stress for the person or to make them feel like they're preventing some sort of fear from happening. And I won't get too into this because I don't want to get off the topic too much, but every time a person does a compulsion, they will feel a sense of relief and then the obsession will actually get stronger. And then the next time the obsession pops up, the temptation to do the compulsion is a little bit kind of easier, right? And then
Mm-hmm.
that cycle is what essentially makes it clinical, meaning it's what interferes with a person's ability to function day to day. Because it's taking up a lot of time, it's excessive, it's distressing. So the main difference between that and generalized anxiety disorder, for example, is someone with generalized anxiety disorder might worry about a bunch of different things throughout the day, and there might not be the presence of what we call the compulsions. They're not really necessarily doing anything to get rid of the distress. So I guess a good way to describe it is if you think of like a scale of anxiety, if like the bottom of the scale, I know some people are going to be listening and some people are going to be watching, but I'm going to use my hands for a second.
Mm-hmm.
If low anxiety is down here at the bottom, high anxiety is up here. Someone with generalized anxiety is just going to kind of like live up here at the high end of it.
Mm-hmm.
Someone with OCD will have spikes. So they'll get triggered, their anxiety will go up, they'll do their compulsion, and temporarily their anxiety will go back down. And then they'll get triggered again, then their anxiety goes back up. So it's a little bit more of an up and down cycle.
Okay. So it sounds like OCD is like um a coping mechanism that comes from having generalized anxiety. Is that an accurate like understanding?
Uh, Kind of. So I guess like the big difference is there is definitely, and I know you probably want to get to this at some point, there's a genetic component to developing OCD too, which some of the brain structures and things like that that might influence it, as well as environmental things. It's not that the person with generalized anxiety disorder isn't doing things to kind of cope or to make themselves feel better. It's more so that it's not so compulsive in nature. So someone with generalized anxiety disorder might kind of just like live in that versus someone with OCD might feel like they have to do these like behaviors to get rid of the discomfort.
Okay. Yeah, that makes a lot of sense. And you're absolutely right. I do want to get into how um OCD and or anxiety affects the brain, what that looks like in the brain, and if there is, I was going to ask if there is a genetic component to that, or is it mostly from the environment we grew up in or like other external factors?
It's definitely a combination of both. So if you do have a first degree relative who has OCD, you're more likely to develop it.
Mm,
And then, if you're also watching that first degree relative, like they're your caregiver, for example, and they're acting as if the world is a scary place to be in, and maybe doing some interesting behaviors or, talking to you about all the bad things that could happen in the day, that is something that we learn. And so that's why, treatment for OCD a lot of times does combine medication, which can address the biological component, and then therapy, which can address the learning component. Although I will say I have seen people get better without any medication too.
okay. And speaking of treatment, what do you think is the best form of treatment in your opinion? I'm sure like it differs from
Yeah.
like patient to patient, but what is like your go-to recommendation? Like, let's try this first before anything else.
Yeah, so I would even go as far to say that this isn't necessarily my opinion. This is
Mm-hmm.
research fact that exposure response prevention is the number one treatment for OCD and also for a lot of anxiety disorders in general.
Mm-hmm.
So there is, like I said, a ton of research. And I think one of the biggest things to remember when it comes to why this is so effective is the place in the brain where anxiety lives literally doesn't understand language. And so when we try to do something like talk therapy, like talking ourselves out of our fears or our obsessions, it doesn't work too well because that fear area of your brain doesn't understand. And that's why a lot of times people with OCD will tell me, logically, Medina, I know that doesn't make sense, or logically, I know I'm sure I'd be fine, but I just feel, right? I just feel like I have to do this. And so the only way to really show someone out of being scared is to behaviorally walk them through what they're scared of. So that's essentially what exposure response prevention is. It's walking someone through their fear and teaching them a couple things. One is that they can handle hard things. They did the scary thing. Maybe it was uncomfortable, but they got through it. They managed. A lot of times people learn that the scary thing didn't happen. Wow, like my worst case scenario didn't actually happen and I was fine. And that just because you say, think, feel something doesn't necessarily equate that it's going to happen. And the only way, again, you can actually have someone truly believe those three things is to physically show them.
Mm, mm. That's a great point. So, just moving into the anxiety space a little bit for people who don't necessarily have like OCD, but they're not sure if they have generalized anxiety because a lot of people have functioning anxiety. Do you approach them if they come to you? Do you approach them with the same treatment, the ERP treatment that you were just talking about? Or are there other forms of, hey, this is what you should do to regulate your emotions, like meditating or exercising? Or I know that you're into health and fitness as well. So do you talk about like dietary components that could be heightening anxiety within people that they might not even be aware of?
Yeah, that's a great question. I would first recommend that you do go to a professional to figure out if it is OCD versus generalized anxiety disorder.
Mm-hmm.
A lot of the ways I would personally treat it would be similar, but I think there are some nuances when it comes to generalized versus OCD. So like with OCD, for example, I actually, which might sound crazy, but I might not actually give someone breathing exercises. The reason I want to give someone breathing exercises with OCD is because that is essentially what we call safety behavior. It tells them and signals to their body that behavior that they can't handle the distress. And so with ERP, we're actually doing the opposite of what you would think a therapist would do, which is a learning curve for me personally, is I'm actually provoking anxiety for an individual versus telling them that they're going to be okay or reassuring them. Because again, I want to show them physically that they can handle hard things. So I wouldn't necessarily give people with OCD those types of skills. But generalized anxiety disorder, relaxation and things like that can be really effective if they're used in an effective way. Because again, we don't want to teach someone that every time they're going through some sort of distress that they have to reassure themselves or that they have to deep breathe. Because some situations there's really no like changing the discomfort. Like I think of death, like death is like, there's really nothing you can do in that situation to necessarily make the pain go away. It's really about just learning to live your life, even though that pain exists.
Right. And just for the listeners, one more time, what does ERP stand for?
Exposure response prevention. So I guess I should probably explain a little in a little more depth, I think, because I talk about it so much. I'm like, everyone knows what ERP is, but so basically it's kind of like the title. You're exposing someone to the thing that they fear, and you're essentially helping them prevent responding the way that they normally do. So if you think about it, it's really nothing that happens to us that's the issue. It's the way we respond to what happens to us that causes us the stress.
That is a good point. Can you dive deeper into that a little bit more?
So I even think I'm a firm believer that sometimes I find us as humans overpathologizing things that don't need to be pathologized. So for example, I don't think necessarily it's the anxiety I might feel in the day that's the issue. It's now oh my God, why do I feel anxious? How come this is happening? How do I make it go away? Am I normal? Do other people experience this? And now I'm 3 hours later and I haven't moved from my couch because I've been ruminating on it and trying to make it go away, versus getting out of my place and living my life and partying like a rock star and seeing friends, right? So it wasn't the anxiety itself that was the issue. It was really just the way I responded to it. Because if we could successfully avoid, quote unquote, feeling anxious, no one would feel anxious. We know that we can't do that. And that's why it's important in situations to realize like, yeah, hey, I feel anxious. I don't like it, but it's also a human emotion. How can I manage and move on with my day, even though I feel that yucky feeling?
Yeah. And why do you think people are scared of that anxious feeling? What does it do in the body that really triggers that sort of like debilitating fear or rumination?
Well, I think why we're scared of uncomfortable emotions is because the tendency is to try to get rid of it. So if I'm constantly trying to run away from something, I'm not exposing myself to it. And if I'm not exposing myself to something, then I'm not what we call habituating or getting used to it. Right. So I give you a scary movie scene, right? It's like really terrifying the first time. But if I give it to you 20, 50, 100 times, on the 100th time, it's not going to feel the same. And so it's not about saying, oh, like, let's sit in the anxiety and just like sit on my couch and just feel anxious, but it's about letting it be there versus trying to push it away. It's kind of like, and if there are any like avid OCD listeners, they've probably heard this example. Have you heard of the pink elephant example?
No, I haven't.
Do you want to do a little exercise?
Yes,
okay.
100%.
So, and anyone who's listening can do it too. So I want you to close your eyes and I want you to think of anything but a pink elephant. So anything you do, just don't think of that pink elephant, not the color pink. Don't think of the elephant, literally anything, not that pink elephant. Okay.
Okay.
All right. Open your eyes. Did you think of a pink elephant?
I thought all things pink, actually.
Yes. And so that's what happens with anxiety and OCD. We say, don't think about it. Don't feel that. Right. And the more you push it away, the more it wants to come forefront and center. And so the opposite of that is, are you ticklish by chance?
Yes, unfortunately. Yeah.
I know. It's like a curse. Um, so if you have someone tickle you, what happens?
I'm laughing, but I don't like it. It's uncomfortable. Yeah, and I want them to
Yes.
stop. Yeah.
Yeah. Have you ever tried to tickle yourself?
Yes, and it doesn't do the same thing.
Yeah, so that's exactly kind of like how ERP works.
Mhm.
So when we willingly do something that's scary, we teach in a way, we're kind of teaching ourselves that we can handle it, right? Versus if
Mhm.
I'm trying to avoid it. So again, that pushing away actually makes things a lot more forefront and center. And the more we approach it, a lot of times, not always, because we don't want to do it for this effect, but it makes it less intense.
Yeah. And you know, you make such a you bring up such a great point about just letting your emotions be what they are. They're uncomfortable and you don't have to run away from them. And I'm forgetting the woman who said this. I heard this a couple years ago, but essentially she says it takes about 90 seconds. I'll try to find um I'll try to find her so I can quote her properly, but she says it takes about 90 seconds for you to kind of feel your emotions go through your body. And if you just sit with it, usually you feel better after 90 seconds. If you're not trying to push it away, if you're feeling embarrassed, if you're feeling uncomfortable, and you just like sit there and just like feel the feelings, like you don't push it away, it takes about 90 seconds for it to kind of move through your body and you start to feel a little bit better. And I've been trying that, and it does work a lot for me when I get into very like stressful, anxiety provoking situations. There's also something that you posted on your page where it was like if you have anxiety, and let me know if I said this correctly, but if you have anxiety about like doing your homework, the first thing you should do is probably just go get your homework and or a project or something and start doing it rather than putting it off and just prolonging that anxiety, because that's what it does to a lot of people. At least for me, when I'm anxious, I just continue to put things off and it makes me feel worse because it's scary to like confront it.
Yeah. Yeah. Well, first off, I think it's great that you're allowing that emotion to be there for a little, because that is part of making action, right? Is acknowledging that you feel anxious about something and then taking action with that anxiety. But yeah, I think what we get sucked into so often with anxiety is sitting there and quote unquote trying to figure it out, right? Like how many times you're like, I just need to figure out how I'm going to do my homework. I'm like, how do you figure out how to do your homework? You actually do your homework. And a lot of it is just anxiety is false. There's so many holes in anxiety's logic, but it's
Mm-hmm.
false belief that um like that you can make things better or you can do it perfectly or just right. And it's like, no, that's not the point. And I see it all the time, like when people try to like work out too. It's like I need to like make a list of like the materials I need or materials, I don't know,
Yeah.
things I need and like what I'm gonna do and how I'm gonna do
Right.
exactly. And it's like, no, just stop. Can you do like 5 minutes of stretching right now? Like I'm actually
Absolutely.
gonna have you stop talking. I do that in session, which again might sound like, oh my God, Medina, it's the worst therapist ever. But if someone is like talking for 10 minutes about how they want to do something, I'm like, hey, let's just do it right now. You want to cook some chicken? Let's cook some chicken.
Right.
Um, and so yeah, it's about and that's the other thing too, is we're often waiting to feel motivated or feel just right before doing something. That's not how it works. We have to do something and then we feel motivated. When do we feel motivated? Before
Mm-hmm.
or after the workout? I don't really usually feel motivated before. It's usually after. I'm like, oh yeah, like that was awesome.
Like I'm in the groove, right? Yeah, I did a great job, right? I knocked it out of the park. You're absolutely right. You're absolutely right. Um, so speaking, so like when we think about anxiety and OCD a lot, I think a lot of the people that I see talking about this are women, and the people who are seeking help for anxiety disorders and OCD and all that stuff tend to be women. And I could be wrong, but from your perspective, like from your line of work, what percentage of men and women come to you for help with anxiety and or OCD?
I don't know that I'll give you like a specific percentage, but I
Right.
will say absolutely it's disproportionately women. And I don't know if that's necessarily because women struggle more or that women are just, I guess, conditioned more to be able to reach out for help, unfortunately. So I think a lot of people, specifically men, probably struggle in silence.
Yeah. Yeah, that was that seems spot on. So but from the men that you've worked with, does anxiety and OCD manifest in them differently than women? I know like it's different for everybody, obviously.
Yeah.
But are there some like stark differences where you're like, okay, this is what it's like in men versus this is what it's like in women?
Yeah, like you said, it's different for everyone, but I will say a lot of times, not always, sometimes, a lot of times, sometimes that's conflicting. A lot of times men will come to treatment with not having like the baseline of emotion identification. So sometimes
Mhm.
I'm working a little bit on that. And even just teaching them like what does anxiety feel like, and thinking of it in terms of a physical way, because anxiety can manifest very physically, is a little bit easier for men to conceptualize, like, oh, like, yeah, my chest is pounding, versus like an intellectual awareness, or I guess heady awareness of what anxiety feels like.
Mhm.
So a lot of times it can be working through that on top of the OCD.
Right, right. And is are anxiety disorders and OCD are these things that people can get over fully, or is this something that people are going to have to manage for the rest of their lives? I mean, I don't know if you can answer that question, but it's something that I think about often.
Yeah, yeah, I can actually give an answer to that. So it is something that's chronic, meaning it never goes away.
Mm,
However, I have seen people recover fully, meaning their life is very managed. Um, so because I don't want it to sound like, oh my God, I'm gonna have this for the rest of my life. So it can be really well managed with ERP, and sometimes in conjunction with medication.
mm-hmm. Okay, okay. That's good to know because I think for a lot of people, there's this whole thing with like alternative health and all that stuff and just kind of shying away from taking medication for mental health ailments. And as a therapist, do you think that medication, um, do you think that there should be more emphasis on treatment that does not require medication, or do you think that medication is something that should always be considered?
Yeah, I'll just give my personal opinion. I always
Mm-hmm.
think less is better. So I prefer not. So typically what I'll do personally with my clients is, let's go through some rigorous ERP. Let's
Mm-hmm.
see how your symptoms respond. If we feel like the symptoms are really treatment resistant, then maybe we're looking at medication management. Because especially with someone with anxiety disorder, someone who's taking meds, that sometimes opens a whole nother vortex of what ifs, like, oh my God, is this medication making me crazy? Like, how do I feel?
Mm-hmm.
Like, they're checking how they're feeling. Is it helping? Is it not helping? And then it's like, whoa, like, hold up a second. Like, let's see if we just try the behavior approach. So I usually use it as sort of a last resort.
Okay. So what are the biggest, in your opinion, like misconceptions about that people have when it comes to anxiety and or OCD?
Yeah, so huge misconception about OCD is that it's like, oh, I'm just like a neat freak or a clean freak. And it's a big reason why our organization exists is because it's not that. It can
Mm-hmm.
manifest that way, but it's not a joke. And I think for me, that sits close to home, because I treat people that literally their life is disrupted. And so when people throw it around like a joke, it can be hurtful, especially if that person, you don't know, if someone might be struggling with OCD in the room that you just joked about that with. So it can manifest in a lot of ways, and it's not just about being clean.
Mm-hmm. And just another question I just thought of. I know obviously as a therapist, you're constantly working with people who are coming to you with, these types of disorders. Does it get overwhelming for you sometimes? And how do you kind of set up like mental boundaries so that you're not kind of absorbing all of your patient's worries and fears?
Yeah, that's a good question. I think part of it is making sure that I'm staying on track with the sessions being behavioral, because
Mm-hmm.
and I'm sure everyone's been around someone who is anxious, and they're just like kind of like going on and on about all the what ifs and what's going to happen. And it's like,
Mm-hmm.
whoa. And so that is when I will, and I always, give good psychoeducation on, hey, sometimes if I find that you're doing a compulsion in session, like ruminating, I'm going to stop that. And the reason I'm going to do that is because I don't want to be part of increasing your symptoms.
Mm,
And so creating that boundary for the client, but also for myself, like, hey, let's stop and let's behaviorally walk through this. And also reminding them that I don't know everything. So I think they can put a lot of weight into our I guess our knowledge or our opinion. Like, what do you think? Do you think that I'm going to be okay if I go on the train today? I was like, I don't know.
mm-hmm.
And I won't absorb it in that same way. Because I'm putting it kind of back on them.
Right, right. Well, thank you. Well, this is a word to the wise, so I always ask all my guests final words of wisdom to the listeners, and it could be about what we've been talking about or something completely different. It's totally up to you.
Yeah. Um, it's not that serious. So, and this is never to minimize anything anyone's going through, but I definitely like to teach people to use humor when it comes to anxiety. To be real, all of us sometimes worry about some stuff that's ridiculous and
Yeah,
not that serious. And so, taking life a little bit more lighthearted can be really useful.
I absolutely agree with that 100%. That's how I live my life. I tend to laugh at myself a lot in a good way, not in like a
Yes.
crazy delusional way. But yes, I totally agree with that. Thank you so much for being on the show. Where can people find you?
So I'm on Psychology Today. So if you go on Psychology Today, you can find my information there. I'm also on Instagram. Do you want me to say it or are you going to link
I'm gonna
it?
put that in the show
Oh,
notes so you don't have to say it.
okay.
But yeah, okay.
Yeah.
So Instagram and Psychology Today. I'll put that in the show notes for the listeners. Again, thank you so much, Medina, for stopping by the show.
Thanks for having me.